I wanted to ask you a bit about sort of the experience of people with disabilities in general, accessing public services and also healthcare, other kinds of public services. It's important to me, I think it should be important to all of us that people have their dignity affirmed when they're accessing services and that they're treated equally. I wonder if you could just share in general terms how you would see the experience of people with disabilities raising issues or seeking public services, interacting with the healthcare system. How would you evaluate kind of how those experiences are based on what you're hearing from your members?
Well, I think in all transparency, I think since the bill was brought in around Track 2 MAID, which made people with disabilities the only group eligible for medical assistance in dying when they're not dying, that has certainly changed people's interaction with the healthcare system quite dramatically. People with disabilities are now very much afraid in many circumstances to show up in the healthcare system with regular health concerns because they're often MAID is suggested as a solution to what is considered to be intolerable suffering that happens to be caused by some of the things like that this committee addresses, like poverty and the situations that people with disabilities disproportionately find themselves in compared to other Canadians.
Okay, that's very striking, and I don't want to be accused of putting words in your mouth, but it sounds like what I'm hearing you saying is that people who have disabilities are interacting with healthcare, seeking other kinds of public services, are proactively being offered MAID when they're seeking completely different services. Is that?
That is correct.
Okay,
that is what I am saying.
Is that is that common? Are you hearing about that a lot, or is it weekly?
Yes. Mm-hmm.
Okay, you're hearing weekly complaints from people who live with disabilities who are seeking other kinds of services, and someone says to them, "Well, have you thought about MAID?"
Yes.
And are you? What do you think we should do about that as legislators? Do you think we should try to stop government officials from proposing MAID to people who are not seeking it, who are seeking other kinds of supports and services?
Well, I think the disability community has made their case that we should repeal, and the UN CRPD committee has also affirmed that Canada should repeal Track 2 MAID completely. But I think in the interim, anything that anyone can do to limit this from being pushed on people with disabilities who are seeking support to live would be a welcome change. Probably not something this committee can deal with, but in your individual capacity as legislators, I'm sure you can.
I want to be clear that I agree with you about Track 2 MAID. Taking action in Parliament is a bit like building a house on a desert island. You have to build with what has washed ashore. So you have to work within what you think is realistic. And I don't think a majority of Parliament would share your view or my view on the Track 2 MAID issue. But it's striking to me that you're saying that in the current reality you have people that don't want MAID, aren't looking for MAID, but who people in the system, people in authority, presume should think about MAID, and people in those positions of authority are actually telling them that.